Okay, so the recording should be working now. Just to give you guys a heads up that the webinar will be recorded. As you can see, you can also enter information or questions in the chat box. Again, this is a series of webinars that we've done so far throughout the last couple months in commemoration of National Hispanic Hepatitis Awareness Day. My name is, again, Tony Ochoa. I'm with the Capacity Building Assistance Division here at the Latino Commission on AIDS. I'll talk a bit about Internet in a minute again. Just for some housekeeping, like I said a minute ago, the lines are currently muted. If at any point you want to unmute your line, you may do so by pressing *7 on your phone, and it should unmute your phone line and we should be able to hear you. If you want to remute your line or mute your line again, you may do so by pressing *7, and you can go ahead and chat or enter information in the chat box. And in the chat box, well, only us, the chair people, Carlos and I, are the only people that would be able to read it. So we'll go ahead, if you type anything in there or pose a question, we'll read it out loud so that everyone else knows that you asked that question. Or if you want to privately let us know something, you can enter that in the chat box too. Again, my name is Tony Ochoa with the Latino Commission on AIDS here in New York City. We'll talk a little bit more about the Commission and National Hispanic Hepatitis Awareness Day in a minute. But I'm going to unmute the lines in a minute to let everybody know who's on the line with us. And I'm also going to let Carlos introduce himself.
Good afternoon to all. My name is Carlos Maldonado. I work for the Commission on AIDS for more than 16 years. I run a program called Puente para la Salud, or Bridge to Health, and Treatment Now. And it's a pleasure for me to be here today.
Great. Thanks, Carlos. So I'm going to go ahead and unmute all the lines right now just so that everyone can go ahead and
the conference has been unmuted.
So the lines are all currently unmuted. So feel free to jump in, give us your name, your city, and where you work.
Good morning. My name is Javier Ortega, calling from Santa Barbara, California. I'm the HIV and Hepatitis C program coordinator for the HIV and Hep C testing program.
Welcome.
Thank you.
Hi, my name is Anna Milanovic from New York ASEAN Network. I'm a health navigator and I screen for HIV and hepatitis C as well.
Hi, my name is Jacqueline. I'm calling from Baltimore. I work for Johns Hopkins Hospital in coordination with the Baltimore City Health Department. I'm the hepatitis coordinator at the STD clinics.
Hey, welcome, Jacqueline.
I'm Andrew Roberts. I work at Project Vita in Chicago. We work with the African American Hispanic community providing direct HIV services.
Great. Welcome, Andrew.
Hi, I'm Diana Diaz. I work at Community Health Action on Staten Island. I'm a counseling, testing, and referral specialist. I do HIV testing and hepatitis C testing.
Hi.
Hello.
Hello. Hi, my name is Yuseida Ramos from Puerto Rico. I work in Ministerio en Jehová Serán Proviso. I have the program coordinator.
Hi, Yuseida.
Hello, my name is Juan Jose Lopez. I am from Chicago. I work for Test Positive Word Network, and here I'm a medical case manager.
Hey, Juan Jose.
Hello, I'm Celestria Guy from Arkansas Department of Health. I'm the HIV prevention trainer and also the Hep C coordinator.
Hey, welcome.
My name is Jude. I'm from Nebraska. I work for the state of Nebraska, and I'm the hepatitis coordinator.
Wonderful. Hey, Jude.
This is Detrell. I'm with the Tennessee Department of Health, and I'm a program evaluator.
My name is Anna Milanovic. I work at ASEAN Network. I'm calling from New York. Health navigator, and I screen for HIV and hepatitis C.
Cool.
Hi, Maria Rodriguez, Program Director at Argus Community Care Coordination, Ryan White, Part A.
Welcome.
Hello.
Hi.
I'm Adrian Hodges. I'm calling up from Buffalo, and I am associated with University at Buffalo.
Adrian. And in the chat box, we have Adrian. We also have Kate from Burlington. She's a viral hepatitis prevention coordinator at the Vermont Department of Health. We also have Beverly, who's in Seattle. We have Drew and Ortega, who's HIV Hep C counselor and HCV case manager. We have Wanda Vasquez in Puerto Rico, Jan from Clinical Advocacy Manager. Anyone else want to jump in? So we're going to go ahead and get started. And again, as you can tell, when we keep the lines unmuted, it can get kind of difficult to hear. So we tend to keep the lines muted throughout the course of the webinar. If at any point you want to ask a question or make a comment, you can unmute your line again by pressing *7, or you can enter that comment or question in the chat box and we'll get to it, okay? So I'm going to go ahead and mute the lines again.
The conference has been muted.
We are the Latino Commission on AIDS. We were founded back in 1990 to fight HIV/AIDS in the Latino community nationwide. We provide services locally, meaning that we do provide programs, interventions locally. We also do HCV, HIV counseling and testing. We have a multicultural, multilingual capacity and staff, meaning that we, especially in the capacity building assistance division, we work with organizations no matter who your target population is, African American, MSM, Asian Pacific Islander, whatever it may be. We can work with you to kind of help you with any programmatic or organizational infrastructural support that you might seek. What else can we say? And like I mentioned again, we have 5 core areas. We do have a research think tank internally, so a lot of the programs that we conduct, a lot of the capacity building that we provide, we evaluate it to make sure that we're constantly improving it throughout the course of its execution. We also do HIV prevention and health promotion, meaning that we do a lot of social marketing campaigns like National Latino AIDS Awareness Day and National Hispanic Hepatitis Awareness Day. Capacity building assistance, it's a service that we provide to anyone, any community-based organization nationwide and within the U.S. territories. With anything that you might be needed, it's completely free of charge or funded by the CDC to provide that support. And we can provide you with any type of technical assistance or support that you might need to enhance, adapt, improve your programs, recruitment and retention, anything you might need, we're there to support. We also do HIV, HCV testing, like I mentioned a minute ago, and we do advocacy and community mobilization, particularly in the Deep South, where we're seeing a lot of new and emerging Latino population, and supporting organizations and providing services to these communities, which are new and emerging. And again, like I said a minute ago, it's local, regional, or national work that we do. And again, we're also a community-based organization as well, which kind of gives us a bit of empathy and understanding how some of these things might be executed and the type of support that we can provide you all. For those of us that haven't been on the previous webinars or don't know what National Hispanic Hepatitis Awareness Day, it's a collective movement aimed at educating and mobilizing the Latino community to increase awareness of viral hepatitis and the high prevalence it has in Hispanic communities. The goal is to draw attention to this by supporting organizations that do work locally, so that we all can kind of form a unified voice and supporting one another, providing a platform to make sure that that awareness reaches our communities locally while linking each other and providing a network nationally. So in a way of summarizing that, the purpose of NHAD, it's the National Social Marketing Campaign, and it takes place every May 15th, which is less than 2 weeks away, to raise viral hepatitis awareness, prevention, testing, treatment, education, and patient advocacy in the Latino community. And there's plenty of ways that organizations, groups, coalitions can participate and get involved with hosting an event in commemoration of NHAD. And here are some potential ideas that we put out there. You can hold a special testing day. You can hand out flyers. You can gather family and friends and have conversations. You can host a cultural event. You can have a visual And we pulled these 10 potential ways of participating in NHAD from the website directly. And here I'm about to show you what that website looks like right now in case you haven't had a chance to go to it. But the National Hispanic Hepatitis Awareness Day website looks like this. You should be able to see it on your screen. Again, that's HispanicHepatitisDay.org. You can register your events here. You can pull resources. You can see information that we've provided and things we've crafted from last year. So again, I really encourage you all to utilize the website where you can find the campaign kit, which has a lot of fact sheets about how hepatitis is affecting Hispanics in the United States and territories, and also resources to help you organize your event locally. With that said, I'm trying to see if I can get back to the PowerPoint, unless I completely messed that up right now. There we go. So that was a quick view of the website. I do encourage you all to visit it if you haven't gone to it to get a lot of useful information on National Hispanic Hepatitis Awareness Day and also utilize the resources that we've created there. So with that said, I'm going to pass it over to Carlos. And again, Carlos is the Director of Treatment Now, Tratamiento Ahora, and Puente para la Salud here at the Latino Commission on AIDS.
Good afternoon. What I have done is, in this second part, we're going to be talking about treatment, and basically what I did was to select some of the highlights of the CROI conference that was done this year, which brought in a lot of good information and very hopeful information for the hepatitis C treatment. No? So this is just a timeline so that we can see how hepatitis C has come into the big highlight. No? In 1973, hepatitis is described as a non-A type and non-B type. So there wasn't really a test that will say this is hepatitis C. So it took several years until 1988 where the hepatitis C virus is isolated. Later on in 1990, the first hepatitis C antibody test came into the market, and it began the screening of blood supplies, especially here in the United States. In 1991, alpha interferon was approved for the treatment of hepatitis C. And in 1993, a supplemental hepatitis C test developed. So now we know that we have, including fast testing for hepatitis C. In 1998, the combination therapy was approved. In 1901, the Food and Drug Administration approved a pegylated interferon. Now let me explain a little bit. So we're going to see that interferons are human proteins, and there is a difference between non-pegylated and pegylated interferon, and the difference has to do that it's easier to administer, and it doesn't require that many, the pegylated is easier to administer, and it doesn't require that many, that constant injections. Both are injected subcutaneous, and they have been proven to be very effective. There's still studies going on whether one is superior to the other one. Those studies have to come into a conclusion, so we know what more or less we have been seeing is that the administration of pegylated is superior.
So you're saying alpha interferon is it's a pill, right?
It's approved. Both are approved, but the alpha interferon was the first one that came into the market, and then the pegylated came in because it brought an advance in terms of it's only a subcutaneous injection or once a week, and it has less side effect because of that.
And so is interferon a pill, or is that an injection?
Both are injections.
Both are injections?
Both of them.
And how often do you generally take or receive an injection of alpha interferon or other?
Well, the widely used now is the pegylated form of interferon, and that's once a week.
This is once a week?
Yes.
Got it.
Okay. So, during the opening day of the 21st Conference on Retrovirus and Opportunistic Infection, CROI, in 2014, featured a press conference on advances in treatment of hepatitis C with a focus on how new drugs may be used in the real world, given barriers such as high cost and shortage of experienced medical provider. And these are two of the most biggest barriers, being the cost, the high cost, of this treatment, which make it difficult for a private insurance to cover, and very difficult for the government to set money aside for this kind of treatment.
Right. So in CROI, it's a conference that happens annually, right?
It happens annually.
And it's specific to opportunistic infections and retroviruses. So they talk a lot about HIV, HCV, and new trials and research that's going on, things that have been occurring, new findings?
That's correct. Not only Hep C, they also talk about hepatitis B.
Okay.
But in this presentation, we're going to concentrate on the treatment for hepatitis C.
Got it.
Okay. And this is what is approved right now in terms of pegylated interferon alpha. And what are they? Interferon is a protein made by the immune system. So it's a very potent protein that rules some of the immune functions. And it's named because it interferes with the viral reproduction. In addition, interferon signals the immune system to recognize and respond to microorganisms, including viral and bacterial infection. So it's a substance that is very important in our body, that we produce it naturally, and that it helps us to control bacterial infection and viral infections. So the infected cell release interferon to trigger the immune response, and there are three types of interferon. There is interferon alpha, interferon beta, and interferon gamma. Interferon alpha is used to treat viral hepatitis and some types of cancer. So that's the more widely used. So we see that we have in the market Pegitron, peginterferon alpha 2B, and that's approved by Merck, and Pegasus with interferon alpha 2A2 that was approved for Genentech. In terms of the nucleoside analogs, what they saw is that they have ribavirin, which is more known, is Ribasfer and Virasol, some different variations of the same substance. It's by Genentech. And what are they? Although it's not effective against hepatitis C by itself, when used alone, ribavirin plays an important role in hepatitis C combination treatment. So scientists have not determined exactly how it works, but it works. However, it is clear that combining ribavirin with pegylated interferon boosts cure rates and reduces the risk of relapse. Both treatment, interferon and also ribavirin, comes with some side effects. So these are very, they have to be monitored, the treatment, and it has to be monitor and apply carefully apply. No.
Great. So again, most medications generally have a brand name, and usually after a while there'll be a generic form that comes out, which will then create a generic brand, right?
Right.
So and like Carlos is saying, this medication here doesn't generally, it's not used to treat Hep C alone. It's used in combination with interferon. So no one would ever receive treatment alone just with this type of medication, but used in combination with interferon, and it increases the rate of success and boost cure rates, right?
Mm-hmm. And another caveat to this, both interferon and ribavirin, what we see is the rate in terms of people with genotype 1 and the success in the response to the treatment is 45% for people with genotype 1 and 80% for those with genotypes 2 and 3. Which in the previous presentation we highlight that the genotype 1 is the most difficult to treat. But in recent studies found slightly higher sustained virological response rates in children, like 48% for genotype 1 and 100% for genotypes 2 and 3. There are some factors that predict the response, a good response or a poor response, and these include gender, male gender, older age, the genotype, and a higher viral load and advanced liver disease. In addition, the studies show that people of African descent are less likely to respond to interferon-based therapy. So there's research that is being conducted with Afro-American that to see what is the difference. Is there a genetic difference in terms of the response, and what are the factors that are creating this kind of situation? The usual recommended course of treatment is 48 weeks for people with hepatitis C genotype 1 and 24 weeks for people with genotypes 2 and 3. So we see a kind of lengthy treatment for hepatitis genotype 1, shorter for the other subtypes, genotypes. Some studies, what it says is that the longer the treatment duration might improve responses rate, especially for people that are co-infected with HIV and hepatitis C.
Right. And for those of us that weren't able to join the previous webinars, those were recorded as well. This one's being recorded again. We'll be sending out the invitation for a webcast that will take place on the 15th. And with that invitation, we'll also send you the link for the previous webinars where we did talk a little bit about more detail on those genotypes that Carlos is talking about. And you also have this recording in there as well, so you can view it there.
Also, to highlight, in numerous studies have shown that the response to therapy at 12 weeks predicts whether or not a person will achieve a sustained virological response 6 months after the treatment is completed. So once you reach with the treatment a certain amount, the doctor can speculate whether you are responding or not. And if you are not responding, then it's not worth it to continue. And that's the policy that has been going on right now. But with the new treatment that are coming up, we see that this is going to be a different treatment. The application of the treatment is going to change.
Great. So depending on someone responding, is that determined by the genotype, the type of HCV it is, or is it by the person as well?
It has a lot to do with some of the factors that the person might have. Okay. Like I mentioned prior, they have seen that Afro-Americans respond less respond in the Afro-American community than the other ones. It has to do with the grade of damage to the liver. It has to do with some factors that might be genetic, some, and other that are in terms of the progression of the disease. It's a very hard genotype to treat. And fortunately, and this is what it was so important that came during the CROI conference, is that the new treatments that are coming in are the people are responding finally to the treatment, especially on those hard to treat patients.
So it's better for someone, because I know we talked about in the previous webinar that sometimes the body itself will treat itself with HCV, and sometimes when it doesn't, that's when treatments like this exist, right? But there are still reasons why, beyond just the genotype, that the body might not respond to certain treatment, right?
That's correct.
But there are medical advancements now that we saw from CROI that you're about to present in a minute that really help with that, right?
Yes. So we have here, and these are some of the approved treatments and the ones that are in phase 3, and I decided to concentrate on those because phase 2, well, there's still a long way to go. And within that, we have the new generation, which are protease inhibitors that block a protein that plays a critical role in hepatitis C replication. And the first generations of hepatitis C virus protease inhibitors son Incivec and Vitrielis. And now recently was approved Cimeprevir and Faldaprevir. And these are very important because we're going to see in the next transparency that they are doing sort of, it's changing the whole treatment phase. No?
So those protease inhibitors, like similar to HIV, right? It blocks part of what the cocktail sometimes does, the medication you take. It prevents the virus from entering the cell that duplicates it, right?
Well, not prevent the entrance, but it prevents the replication of the virus.
Got it.
Protease is a polyprotein that is a protein that is very highly used. Actually, it's an enzyme, that is highly used by the virus to be able to replicate. It's the one that puts together the virus and expel it out of the cell. So it plays a big role in not only on HIV, but also on hepatitis C.
Great.
And this is one of the presentations that was by Douglas Dietrich. The next generation of hepatitis C protease inhibitors, Cimeprevir, cure almost 80% of previous untreated people with hepatitis C and HIV co-infection. So we know that this is a population that are more, it has more complication in terms of the immune response. No? The immune response is fighting not only HIV but also hepatitis C that can be taxing to the body. When used in combination with interferon and ribavirin, so we're seeing that this is just adding to the established combination already. The treatment was fairly well tolerated. The most common side effect reported was headache and nausea, which is in reality is not that hard side effect. And other side effects related to the interferon ribavirin was neutropenia and pruritus and rash. And neutropenia is the more serious one, which is a depletion of white blood cells.
Right. And this is very important because, again, we do see a lot of co-infection with hepatitis and HIV, right?
That's correct. Plus, it's the more difficult population to treat.
Right.
So also during the conference, it was reported that the Faldaprevir added to pegylated interferon and ribavirin cured nearly 3/4 of the people with genotype 1 hepatitis C and HIV in difficult to treat patients. 50% of the participants have liver cirrhosis in this clinical trial. 22% were prior relapsers. That means that they have done treatment and they fail. So they relapse again. And more than 3/4 were treatment naive. That means that they didn't have a prior treatment. All of them were stable on antiretroviral therapy. The therapy was well tolerated and the difficult to treat responded better than the naive. So now we're seeing a big change in terms of treatment. We're seeing that with these new medications that are coming into the market, is changing the response of those hard to treat patients. So this is very good news. And we have the nucleosides and nucleotide polymerase inhibitors, and within that it was reported Sovaldi, sofosbuvir, and ledipavir, tenofovir. What are they? These drugs block the NS5B protein, which plays a role in the replication of hepatitis C, and is involved in creating copies of the viral RNA genome. So these are nucleoside and nucleotides, and which is very common in HIV treatment. No, we know by HIV that nucleoside plays a big role, and the nucleotide also plays a even bigger role. And the difference between a nucleoside medication and a nucleotide is that the nucleotide is already sort of like pre-digested. The cell doesn't have to transform it. It goes directly, the chemical goes directly into the cell, so it makes it more stronger as a medication. No? So in phase 2 studies, sofosbuvir has been shown to be highly effective and shows great potential for use in combination with other nucleotides, no? And notably, said the one that Gilead Sciences is working, tenofovir. And what they're saying is that there might be a possibility to use two of these components without having to use pegylated interferon or ribavirin, which could improve the quality of life of the people during the treatment, because since interferon and both ribavirin and interferon are they're related to higher side effects, no? And sometimes the reason why people don't want to go into treatment.
Okay, William is saying that ledipavir is a generic name, and tenofovir is a different compound also under development by Gilead.
That's correct.
Okay.
Another study presented by Susanna Nagy from the Duke Research Institute using an interferon-free regimen of sofosbuvir plus ribavirin for 24 weeks led to sustained response of previously untreated people with genotype 1 hepatitis C and HIV co-infection, and 75% obtained a complete suppression of hepatitis C. So this is another very good news in terms of these compounds that are becoming more into the market now. New compounds that can be used differently, and that is beginning to have a response on this hard to treat genotype. So there's also another protease inhibitor, faldaprevir, that added to pegylated interferon and ribavirin cure nearly 3/4 of the people with genotype 1 hepatitis C and HIV in difficult to treat patients. Once again, this is a very compromised, immune compromised patient, and that response of 3/4 of response is very high, which brings a different and a better treatment combination. Mm-hmm. So another of the treatments that are in phase 3, we had daclastavir that doesn't have a brand name yet. These are just generic name, and it's in phase 3, and it's been produced by Bristol Myers Squibb. Ledipavir, also in phase 3 by Gilead Sciences, and ABT267, which is in phase 3 by AbbVie. And what are they? NS5A is a protein of the hepatitis C virus, is part of the hepatitis C replication complex with multiple functions in the viral cycle. So the discovery of this protein has been key in developing new treatments. These inhibitors are currently being studied in combinations with agents in other drug classes and show potential use for use as a component of interferon and ribavirin-free regimens. So part of the thing that we are looking at here is these new generations of treatment that are coming out are less side effects and it doesn't have to be used with interferon or ribavirin. And that was a big highlight of the CROI conference this year. So finally, for the first time this year, there was a really move forward in terms of the treatment of hepatitis C. In the PEARL study, in phase 3, one of the few that the AbbVie company is conducting reported a 99% of cure of genotype 1B hepatitis C infection. That is unheard before. Utilizing a direct-acting antiviral combination, we should expect this treatment to be available by the end of 2014. It's been it concluded the phase 3, so very soon it's going to be sent to the FDA to be revised, and they expect by the end of the year to be available. So in conclusion, and those were the highlights, advocacy in hepatitis C is extremely important because medications are extremely expensive. And they're talking about, let's say, Sovaldi treatment, which is a new treatment. What is they're saying is that it costs $1,000 per pill. And imagine if you have to be 12 weeks in this treatment or longer, the amount of the expense is extremely high. So we need to do something concerning these prices. They are very good. These new medications that are coming into the market are very potent. And as you saw in the different slides that I presented, people are responding better to these new compounds. And we need to promote hepatitis C testing in our community because hepatitis C can be cured. That's the difference between, or it can be going into remission and the same cure, no? That's a big difference from HIV. We're still not there yet. But with hepatitis C, we can achieve that. We must keep advocating for more research and to support the development of a parentic vaccine. And as well, we saw the ones that were in the previous presentation, that's a big nightmare in terms of developing a preventive vaccine because of the different genotypes that they are. So it makes it extremely difficult to come out with a vaccine that works for all those genotypes.
Great. And then like we mentioned before in the previous webinar, unlike HIV, there's a ridiculous number of people worldwide that aren't being tested at all. There's a large number beyond just what we're expecting with what we've seen with HIV, where people just don't even know that they have Hep C because they might be asymptomatic, they're not showing any symptoms, right?
That's correct. This is that they call it the silent killer because it takes so long to you really see these effects on the liver. No? So it's very important that, especially the population, what they're called the baby boomers, people that were born in the 1948 on until I believe it's 1972, they should look and have hepatitis C tested as part of their prevention.
Right, and it's also been seen that Hispanics are being infected at younger ages compared to Caucasians and African Americans. So in comparison to African Americans and Caucasians, Hispanics are becoming infected with hepatitis C at younger ages. And there's plenty of reasons we can speculate about why Latinos aren't being tested or why they're not seeking treatment. A lot of them can potentially be, general lack of knowledge, immigration status, lack of health care. Undocumented immigrants are one of the populations that aren't receiving coverage under the Affordable Care Act. So again, there are plenty of barriers that we're kind of experiencing from lack of general awareness about hepatitis C to just lack of coverage and ability to seek treatment altogether. That really puts us in a place where we really do need to address how hepatitis C and hepatitis in general is affecting Latinos nationwide and in our territories.
Definitely, advocacy, like I said, is key in terms of making these new treatments available to everybody. Like I said, the treatment cost right now is unheard. I mean, it's so high that it's unbelievable. So you question how many insurance companies are going to be willing to pay those new treatments, or how willing the government is going to be in terms of making this accessible to the people. So we need to keep advocating for to reduce those prices.
Right, especially in a place where Hispanics are reaching cirrhosis and mortality rates, meaning that they're dying from cirrhosis at a higher rate when compared to non-Hispanic blacks and whites. So there's plenty of reasons and a lot of motivation that goes behind why we need to raise awareness and get involved in making sure that we educate the Latino community about hepatitis C and advocate for treatment and seek out treatment so that the disparity isn't there, right?
That's correct.
Great. So I'm gonna open the lines right now, meaning I'm gonna unmute the lines in case anyone has any questions or comments that they'd like to make. Okay, so I'm gonna go ahead and unmute the lines right now.
The conference has been unmuted.
And if you want to pose a question or ask a comment, ask a question or pose a comment, you can also do that in the chat box. But the lines are all currently unmuted in case you want to make a comment or ask a question. If not, that's completely fine. It just lets us know that Carlos did an amazing job of trying to explain something that is very, very, that was very comprehensive and oftentimes it's very difficult to kind of summarize within a time frame of an hour. So I thank you, Carlos, for taking that endeavor on. But the lines are currently unmuted in case anyone wants to ask a question, or again, you can pose a question in the chat box.
So there is a question saying that why Latinos have a higher chance of getting hepatitis C. There's still, like Tony was mentioning, there's some that might indicate why. They're doing the same thing that they're doing with the Afro-American community, that they're looking at some genetic predisposition. They're also looking at the Latinos, and especially we mentioned the last time that the Puerto Ricans within the Latino community are extremely high numbers. It could be used. It could be because of many reasons. In terms of accessing treatment, accessing medical care. Might be one of the things, and that might be related to immigration issues, or basically the cost of health plans. No, now with the new
Yeah, great, thank you for lowering that. That was a little distracting.
So I was saying that
but like Carlos was saying, that there are plenty of speculation around that, and a lot of it I think comes down to social and behavioral determinants, which is kind of what I detailed a minute ago. General lack of healthcare access, general lack of knowledge, general lack of how HCV is transmitted, that really puts people at risk of contracting it more. That really, would then explain why there's higher rates of HCV and hepatitis in general within the Latino community. There's also pre-existing conditions that Latinos oftentimes experience that also then contribute to the effects of HCV, which are things like hypertension, diabetes, obesity, and other things that really do affect the way hepatitis in general, not just hepatitis C, unfolds. So there's lots of contributing factors that affect that.
Also, there's another highly used intravenous drugs, the intravenous drug use community. That can be another factor that has to be taken in consideration when we're talking about this.
And there's something to mention. There are very few research studies that are including Hispanic participants, and this is a big issue. And oftentimes it's not. It could be that some of these research studies aren't doing as well of a job trying to reach out to the Hispanic communities, but it could also be the fact that there's a lot of apprehension and a lot of reservations on the part of the Hispanic community to get involved in these research studies. And it's crucial, especially like Carlos mentioned earlier, that certain medications certain communities aren't responding well to certain medications. And we don't find that out oftentimes, or we won't know whether or how that affects certain ethnic or racial populations if those populations aren't being involved in the research or aren't participating in the research. So it's also important that, again, it's crucial that we understand that there's so many ways in which we can raise awareness or impact the way in which we can get involved to affect the way we kind of help the Hispanic and Latino community receive treatment or get involved in general, from advocacy to general awareness to getting involved in research. So there's plenty of areas of potential involvement that can really support or be supported by our efforts.
There's a question here that says, will you please repeat what hepatitis is? Hepatitis C is a virus and affects mainly the liver, and it's a They call it the silent killer because it can take up to 25 years or more in order for symptoms to occur. So it's a very silent killer.
So hepatitis in general means the inflammation of the liver, right? So hepatitis affects the liver. Hepatitis is just the inflammation of the liver. There's viruses that exist that affect the inflammation of the liver. One of those viruses being viral hepatitis C. And there's plenty of other types of virus. In the United States, a lot of people are vaccinated at a young age to prevent the onset of hepatitis A and B. But there are certain types of viral hepatitis, like viral hepatitis C, where there isn't that vaccination to prevent the onset of hep C. So there's different means as to why the liver might be inflamed. One of them is viruses that exist, and one of those viruses being hepatitis C, viral hepatitis C.
And since it doesn't have a vaccine, that's what prevention and testing is so important, no? So there are different types of hepatitis. You have A, B, C, G.
There's plenty of them.
So there are plenty of them. Some of them are mild in terms of you will never die or develop cirrhosis, like hepatitis A and G. Others are really bad for your liver, and in that category you see hepatitis B.
And again, that's something we covered in a lot of detail during the previous webinar. We did record that just like we're recording this one, and we will be sending that one out in case you want more detailed information about hepatitis and what it is. which was covered during the previous webinar. So we'll send you the links to those videos so you can view them along with the recording of this one. And Adrian asks, can we review some elements of stigma regarding hepatitis C? Adrian, do you want to talk up a little bit about stigma and hepatitis C? Are you on the line right now?
Yeah, I'm here.
So what do you want to say about the elements of stigma and hepatitis C?
No, I just wanted to see like what specific elements of like stigma as a construct regarding Hep C in Hispanic communities. You know, I'm kind of new to how, I mean, regarding to you know, the construct of Hep C, and I just wanted to see like what's kind of known about the stigma behind it. I know like some of the big things, like it can be stigmatizing, or it's stigmatized to you know, like IV drug users and things like that. So I just kind of wanted to see what the general stigma elements are behind that.
Well, personally, I feel like it's a lot less stigmatized than HIV. But like you said a minute ago, due that one of the highest rates of HCV does happen within the injection drug using community, you would see why someone would feel stigmatized because of that. But there are a lot of other means in which someone can be infected with HCV that oftentimes isn't as directly stigmatizing as it would be like something sexually transmitted, as we see with HIV and IDU injection drug users, right?
You see more stigmatization on co-infection with HIV and hepatitis C. Those people are more stigmatized because of the HIV component. In hepatitis C, well, it's less, because remember that this was, like you saw in the timeline, they really named it very recently as such. They sort of identify and isolated the virus. So anybody that during the lifespan that was born from the 1948, the blood, there wasn't a test developed at that time to see if they were infected with hepatitis C. So you have a big chunk of the population that might be walking over there around us that are hepatitis C positive. And that's the important thing to promote testing.
Oh, got it. Thank you.
Problem. And again, I really do encourage you all to utilize the website. There's a lot of questions that people ask in general about certain transmission methods and certain percentages based on transmission that is explained in very well and concise detail in the campaign kit and those fact sheets that I mentioned a minute ago. So, and those fact sheets are great for you to kind of use internally, and also to use with potential clients that really speak about what puts people at risk for HCV, how it's diagnosed, how it's transmitted, and how it's affecting Latinos. So how hepatitis C is affecting baby boomers, like Carlos just mentioned, and how it's affecting different types of different segments of the Latino community, Puerto Rican, Mexicans, Cubans, and so on.
I have a question.
Would you like some coconut water?
Hello?
Yes?
Okay, did you say the hepatitis C virus treatment will cure hepatitis C, or it will go on remission?
The treatments, there's some people that naturally resolve the infection. Okay, that's why sometimes the doctor waits in order to start treatment, if that person can clear it up. In terms of the treatment, yes, there is a remission, but more than that, they're talking about a cure. So you can be results, and this is one of the that can be, if you get exposed, you then get reinfected. And the more that happens, the more dramatic your prognosis are going to be.
Okay, thank you.
Does those have been some great questions people are asking and comments that are being made. Again, we will be sending out the links to the previous webinars. The first one was a general webinar where we talked about National Hispanic Hepatitis Awareness Day, how some of those numbers around how Hispanics are being affected by hepatitis. The second one was one that Carlos spoke about, which was a lot more detailed around what hepatitis is, how it's being transmitted, specifically affecting certain ethnic groups within the Latino community. And this third one is solely on the current treatment and medical advances that we'll see in the future that are kind of on down the line that we can potentially expect to see come out in the future to really aid with the treatment of hepatitis C. So again, if you have any questions specific to what hepatitis is, that will be in the second one. And anything along the lines of treatment and the future of treatment was discussed during this one, and we'll go ahead and send that information out as soon as it's available to everyone that's attending, and also for everyone that wasn't able to attend during today's webinar. If anyone has any questions or comments or anything anything along the lines of getting involved with NHAD, again, it's something it's a dire need. And we do encourage everyone to get involved in any which way they might see fit. Anything from handing out flyers to holding an actual event to doing more focused testing. We're here to support one another. So I encourage you to kind of seek out the website, HispanicHepatitisDay.org, that I showed at the beginning. And also contact me if you have any questions or comments. You can do so by emailing me here at tochoa@latinoaids.org. And we'll try to be available to support each other in any way possible. With that said, we're going to go ahead and thank you guys again for joining us today, and we'll be in touch. Great.
Thank you. Bye-bye.